OGLEE in the house once again. Thank goodness. Man, they said the folks at the hospital going crazy with this coronavirus diagnosis. They said if you stump your toe and go to the ER, they gonna diagnose you with coronavirus. I ain't lying.
Didn't swab me or test me or nothing to look what the fuck paper say. Reason for visit, fever. Diagnosis, COVID-19. They didn't test me for this shit. He told me I had it, bro. He didn't test me for it. He told me I fucking had it, bro.
Right now, Medicare has determined that if you have a COVID-19 admission to the hospital, you'll get paid $13,000.
He told me I fucking had it, bro. Come on now. Look at what my temperature was. I ain't even had no temperature when I went in that bitch. Come on now.
If that COVID-19 patient goes on a ventilator, you get $39,000.
But because I told him I can't taste and smell, he know I got it. Oh, well.
Nobody can tell me after 35 years in the world of medicine that sometimes those kinds of things impact on what we do.
Well, that's the number one symptom that's been going around lately is not the smell or taste. So I'm not going to say, we're just going to say you have it and quarantine you for 2 weeks. That's exactly what he said, bro. We're just going to say you have it.
If someone dies with
COVID-19,
we are counting that as a COVID-19 death.
No, I can't imagine if someone comes in with coronavirus, goes to an ICU, and they have an underlying heart condition and they die, they're going to say cause of death, heart attack. I cannot see that happening.
I'm going to tell you have it.
Well, in short, it's ridiculous.
So they diagnosed me with coronavirus. I'm going to tell you have it.
I spent some time earlier today just going through the CDC's manual on how to complete death certificates and the parts that were specifically written for physicians. And in that manual, it talks of precision and specificity.
They didn't test me for this shit. He told me I had it, bro.
In cases where a definite diagnosis of COVID cannot be made, but is suspected or likely, like the circumstances are compelling with a reasonable degree of certainty, it is acceptable to report COVID-19 on a death certificate as probable or presumed.
He didn't test me for it. He told me I fucking had it, bro.
The determination of the cause of death is a big deal. It has impact on estate planning. It has impact on future generations.
But because I told him I can't taste and smell, he know I got it.
As we see politicians doing things that aren't necessarily motivated on fact and science, the public's their trust in politicians is already wearing thin.
Well, that's the number one symptom that's been going around lately is not the smell or taste. So we're just going to say you have it.
What do you say to those folks who are making the claim without really any evidence that these deaths are being padded, that the number of COVID-19 deaths are being padded?
Well, that's the number one symptom that's been going around lately. We're just going to say you have it. That's exactly what he said, bro.
You will always have conspiracy theories when you have very challenging public health crises.
So they diagnosed me with coronavirus.
They are nothing but distractions.
We're just going to say you have it.
Well, I would remind him that anytime healthcare intersects with dollars, it gets awkward.
COVID-19.
If you have a COVID-19 admission to the hospital, you'll get paid $13,000.
COVID-19.
If that COVID-19 patient goes on a ventilator, you get $39,000.
COVID-19.
Nobody can tell me after 35 years in the world of medicine that sometimes those kinds of things impact on what we do. You'll get paid $13,000. Nobody can tell me after 35 years,
COVID-19.
Sometimes those kinds of things impact on what we do. You get $39,000. Some physicians really have a bent towards public health, and they will put down
COVID-19
or whatever because they'll get paid $13,000.
COVID-19.
That's their preference.
So they diagnosed me with coronavirus.
$13,000.
COVID-19.
I try to stay very specific, very precise. If I know I've got pneumonia, that's what's going on, the death certificate. I'm not going to add
COVID-19
just because it's convenient. $13,000, $39,000.
Well, that's the number one symptom that's been going around lately.
I mean, let's just take someone getting hit by a bus. And they collapse along and they go into the emergency room and they're there for 15, 20 minutes. Blood work comes back, COVID test comes back positive, and they die 20 minutes later because of their collapsed lung. We're going to put that down as COVID-19?
Well, that's the number one symptom that's been going around lately.
That doesn't make any sense.
Well, that's the number one symptom that's been going around lately.
It's ridiculous.
Didn't swab me or test me or nothing to look what the fuck Paper say diagnosis COVID-19.
That doesn't make any
They didn't
sense.
swab me or test me or nothing.
It's ridiculous.
Diagnosis COVID-19. They didn't test me for this shit. He told me I had it, bro.
That doesn't make any sense.
A lot of things don't seem to make sense with this coronavirus. But I tell you what, I'm going to shelter in place and keep my social distance. What I've been doing during this pandemic is I started the practice of yoga. I didn't know yoga was all that. I thought yoga was... I didn't know they did all that in yoga. I'm going to start watching yoga instead of the NFL. The NFL. Are you ready? All my rowdy friends are here. All my rowdy friends are here. NFL. Look out, NFL. I think this yoga thing may take over. This shelter in place thing may not be so bad after all. Are you ready? Anyway, this is OGLEE, and I'll see you again soon. Stay strapped.